Good afternoon, instructor and class. My name is Jennifer Newton, and today I'm going to introduce two experts that are going to speak on post-traumatic stress disorder and its treatments, also known as PTSD. First, I'd like to give you a brief overview of post-traumatic stress disorder. PTSD and returning troops from overseas is significant and translates into thousands of service members being affected. Furthermore, their loved ones are also affected. Veterans with PTSD is becoming a large issue, with 20 veterans a day on average committing suicide, and also with a delayed healthcare system. The topic of veterans and PTSD is a sensitive subject to many who suffer from it, and also their family members. There is not a debrief surrounding combat issues when military personnel return stateside. A lot of times military vets return home and are expected to go right to work with little or no transition. Their feelings are often suppressed so they can stay on their task. Studying and bringing awareness to PTSD is important because it is a silent killer. Veteran suicides accounted for 18% of all American suicides in 2014, with 70% of the victims not seeking professional help. Military veterans are hesitant to seek treatment because of the stigma surrounding speaking with a psychologist and because they are concerned of the implications it may cause. Furthermore, veterans with PTSD have a delayed health care. Those that are left untreated can have further implications in relationships, workforce, and everyday life. Their issues surrounding PTSD is that there is not enough research to support an effective treatment method. So I would like to ask, does exposure expressive writing help decrease the daily struggles of PTSD in those that have served in the military? And also, does exposure expressive writing help decrease the strains of personal relationships in veterans that are diagnosed with PTSD? Today I'm going to introduce two experts, Dr. Joshua Smith and Dr. Brett Moore. Dr. Joshua Smith spent 20 years in the Marine Corps. He retired as a Master Sergeant, leaving with a bachelor's in psychology. He decided to continue his passion in psychology after he retired. He completed his doctorate at the University of Nevada, Reno, and currently works at Naval Hospital Cherry Point as a psychologist. He has also served as director of the mental health ward. Dr. Brett Moore is currently finishing out her last of 4 years of residency at St. Mary's Hospital in Reno, Nevada. She has a passion to help others suffering from post-traumatic stress disorder and hopes to do so through veteran affairs. She would also like to help further research and effective treatments for PTSD. Dr. Joshua Smith and his colleagues wrote an article discussing the effects of life writing in veterans with PTSD. They further discussed mood in their daily lives. Results in a study showed no changes in PTSD diagnosis or symptoms. However, there were significant improvements in mood and post-traumatic growth. Expressive writing greatly alleviated neuroendocrine responses to traumatic-related memories, along with physiological response being reduced and recovery enhanced. Positive mood changes improved relationships and daily life. Our second expert, Dr. Brett Moore, and his colleague Walter Penck wrote a book surrounding the treatments for PTSD. They covered medical and mental health treatments in their book and which ones were effective. Dr. Moore suggested that exposure writing therapy was a form of effective treatment. However, it is not the most significant form and should not be a primary focus. Clinical work is often based on the preference of the practitioner and may not be the best option for a patient. Pharmacological show a greater promise in the treatment for PTSD in veterans than writing. Furthermore, more research should be completed to have a better understanding of treatments for PTSD before concluding exposure therapy helps. To compare, Dr. Smith and Dr. Moore both agree exposure therapy showed evidence to support its use for PTSD treatments. Dr. Smith pointed out that post-traumatic growth was observed during these studies. Exposure writing alleviated responses, and the recovery was enhanced. In contrast, Dr. Moore suggested that other therapies were available and may be better, that clinical treatment was based on preference of the practitioner, and suggested that more research should be done before concluding anything. To find out more information surrounding PTSD and PTSD treatments, please consider any of these references to guide you. This concludes the presentation, and thank you for your time.